This module will be reviewing a mechanism for brief feedback, particularly focusing on how to make it easy so it happens and how to make it stick. I want to start by differentiating feedback versus evaluation. Feedback is growth-focused with the goal of helping them do it better next time, versus evaluation, which is where we assess their past performance and compare it to some kind of gold standard, either an evaluation tool or milestones. In either case, there's this continuous cycle of observation, feedback, and then at some point, we as faculty or supervisors then need to generate an evaluation of a learner. So we're going to have two modules that talk about how to give high-quality feedback. Today's is going to focus on brief feedback. So to compare and contrast, brief feedback is generally based on a single observation, and it's really in the moment, versus summative feedback, which is synthesized from multiple observations. Summative feedback is typically scheduled, like at the end of a rotation. Brief feedback can be both reinforcing and constructive. Reinforcing feedback can always be given in public, and sometimes low emotion, constructive feedback can be offered in public. Something like, hey, next time, make sure you include the social history. Whereas summative feedback is usually conducted in a private, kind of sit-down setting. Brief feedback is not meant to be evaluative. You're just helping them get better. Whereas summative feedback usually incorporates some type of assessment or evaluation standards. So in terms of brief feedback, let's talk about what works. First, it's best to focus on objective, observable behavior versus personality traits. An example of that would be to say, this learner spoke softly, and I had a difficult time hearing her contribution, versus this learner is shy. Feedback should be proximate in time to whatever observation you've made, because delayed feedback is too often discounted. Brief feedback should also be focused on a mutual goal, something that both the learner and the supervisor agree is something important that they should be learning in this experience, versus a supervisor's pet peeve or preference. So step one for high quality feedback is to observe with intent. Ask yourself, as you're observing a learner in the clinical setting, what am I looking for? What am I listening for? In this situation, what are the key things that this learner must know or do with this type of patient? And are they doing it? And how effectively? Step two is to kind of, in your own mind, make this assessment. What do I reinforce versus what needs constructive feedback? Never miss an opportunity to reinforce the good. Focus on things that they have mastered by saying things like, keep doing this. It's good you thought of this. What needs constructive feedback? Look for one or two things that they can do better next time. Saying something simple like, next time, do it this way. So as we're actually constructing some feedback to give our learner, it's helpful to use this sequence. Start with a brief observation, tell them why it's important, and then make a suggestion for next time. Brief observations can really be cued by using words like, I noticed, or I saw, or I heard. Tell them it's important. This is important because, or it's important to get this right because, and then offer a suggestion to actually change their practice. Let's use an example of a patient communication that you overheard when working with a learner. The learner is in charge of communicating the plan of care to the patient, and let's hear what she has to say. Or he has to say, today we're going to de-escalate your VANC since your culture is negative. This could still be coag negative staff, but we know it isn't MRSA. Sound good? So let's start with a brief observation. I heard several medical terms that she may not understand, like de-escalate and cultures are negative. This is important because we want to understand why we make changes to her plan. So you may want to try saying the infection is not in your blood and we're changing your antibiotic to a more specific drug for your infection. Brief observation, state the significance, and give them a suggestion for how to do it different next time. When it comes to making suggestions, there's a couple of strategies that can be helpful. One is always use a future focused. Instead of focusing on what they did wrong this time, just tell them how to do it better next time in the future. Next time, try to review the red flags for headache before you go in the room to make sure you ask them all. Another strategy is to kind of share the struggle. acknowledge that what they're working on is hard, and maybe it's something that you yourself were challenged by or still are. So you can use a kind of collaborative statement like, well, when I get stuck, I try. When I get stuck between these two diagnoses, I look at the risk factors the patient has. Or it was hard for me to be ready for clinic, so I started reviewing patient lists the night before. Now let's practice. You're working with an acting intern who's assisting with an IND of a skin abscess on the patient's thigh. When doing the procedure, he uses the scalpel to make a superficial nick in the skin and incises laterally toward healthy tissue. This requires several repeated attempts to open the abscess cavity. So which of the following would be effective feedback? So the goals of this session were to start by differentiating feedback and evaluation. Feedback, brief feedback in particular, we're focusing on this kind of in the moment, even single session observations. And we're going to deliver it using a brief observation, a statement of significance, and then a suggestion for how to do it better next time.